Well, the fight against COVID-19 continues in our province. And as frontline healthcare workers look out for us, the Health Sciences Centre Foundation is working to look out for them and Manitoba families needing support. It's now launched a COVID-19 crisis response fund. We have Foundation President and CEO Jonathon Lyon joining us this morning by Skype. Thanks for joining us, John.
Great to be here. Thank you.
Let's talk a little bit about this crisis response fund, just why you wanted to launch it and who you'll be supporting.
Well, thank you for the opportunity. HSC is Manitoba's largest hospital and a provincial hospital. Every day there's over 40% of the patient population is from rural and northern Manitoba in addition to Winnipeg. And we feel that there's an opportunity and a responsibility to support the front line, support those patients during this crisis. So we've established the COVID-19 Crisis Response Fund to support frontline care and patient care. So we kicked it off on Monday with an ask to support some iPads for the ICU department. And now we're expanding it today to support over 400 televisions and telephones in the hospital wards so the patients can connect with their loved ones because they can't have visitors. So that's one way that we can help support. And we're creating this larger fund so that we can be there for the duration of this pandemic for challenges yet unforeseen. So we're asking people to step up, and Manitobans, as they always do, with financial donations to our foundation, just so that we can support those frontline heroes and patients at Manitoba's hospital.
John, I'm really glad you brought up the iPads. Obviously, this is such a scary time for so many folks in our province. We're all feeling that uncertainty. Obviously, those visitor restrictions are necessary because of what we're going to as we try to slow the spread of COVID-19, but people still need to connect with their family members. I know you just are bringing in that technology, but what have you heard so far from patients and from healthcare workers?
Well, we hear the need, right? So, for instance, we started on the iPads. They will be delivered and installed today in the ICU, and the ICU doesn't have these television and phone units. And again, as a way to hit the rest of the hospital in an efficient way, we are going to fund for a period of time those units within the hospital so that patients can connect with their loved ones. And that's also a support to our healthcare workers who need to be able to focus on delivering care.
John, this is obviously a fluid situation. I know you mentioned that you're not sure entirely where you'll go with this response fund because the needs will obviously change as the situation develops, but you obviously can't do it without the support of Manitobans. What do you need from us?
What we'd ask is that Manitobans continue to step up, donate where you can, support our foundation by going to www.hscfoundation.md.ca with a contribution of any means that you can make, appreciating it's a very difficult time. Or you can call us at 204-515-5612. Manitobans have a history of being the most philanthropic in the country, a history of pulling together in a time of crisis. This is a crisis in healthcare. At Manitoba's hospital, we're calling on everyone to please continue to step up and support us all because we need these frontline healthcare workers to support us all. And we're very thankful and appreciative of all the work that they're doing.
John, quickly before we let you go, thank you for that message of hope and that call for support. We are asking people that we interview how they're dealing with this, how they're coping with this pandemic and the changing world around us. How are you doing?
I'm good, thank you very much. You know, my family is safe. We are, as a foundation, working extremely hard, all of our team and our board, reaching out to members of the community, dealing on a daily basis with hospital leadership, and frankly, just working hard to identify where the need exists and what we can do to respond, and then connecting with our incredible donors and media and our media partners. And we're just appreciative of this opportunity. So, you know, we're strong people. We'll fight on, we'll forge on, and we'll get through this, working together and collaboratively. So appreciate the opportunity.
Well, we are certainly grateful for the work the Health Sciences Centre Foundation does in our community. John Lyon on the line this morning. Thank you so much for that.
Thanks, Gabby.